Hello, and welcome to Eyefinity Learning. This is our training webinar series where we will be, well, not we, I will be presenting co-management in Eyefinity Encompass. I am Kimberly Lewis, and I'm thankful that you're joining me today. We're just going to go ahead and get started here. And let's get some things out of the way. Okay, hopefully you can see my screen very well. And like I said, this is going to cover co-management and the proper steps of documenting. Let's talk for a second. We know that within eye care, an optometrist co-managed plan simply refers to a collaborative approach where the ophthalmologist complete the surgery and the optometrist share in the responsibility for the patient care. Okay. The surgery diagnosis and eye disease are treated by the ophthalmologist, which is followed with care. Sorry about that, guys. I had to cough. Which is followed by the eye care, including any needed vision correction that needs to be performed by the optometrist. But to get a clean claim, we must document the post-op operative care correctly, and I want to show you best practice. Now, when it comes to co-managed visits, there are a few that we could speak of, such as glaucoma or refractive surgery. But today I want to cover cataract surgery follow-up. Let's get started. In reality, when the patient makes the appointment, that's where the visit starts, okay? For a co-managed visit, it starts when you get that fax sent over to you from the ophthalmologist of release. I have my patient scheduled here. I'm gonna go ahead and click on him. I'm gonna click on his little body here. And I'm gonna go into eligibility authorizations, where you'll see he has Blue Cross Blue Shield. I'm gonna head and exit from the calendar. I'm gonna go to eligibility authorization. So I got the fax sent over to me that says that Odin's been released. So I'm going to click on eligibility. It will be a medical exam. But these claim details are what I want to talk to you about. I would mimic in here whatever I got from the fax, okay? So if the fax came over and it was a IOL performed, of course, I would choose yes here, right? If it was not, then I would choose no. I would put my referring doctor here. This is who is being released, okay? Who's releasing Odin back to our care? If it's a post-cataract, then I'm going to choose yes. I choose the date of the surgery. Let's say the surgery date was yesterday. I choose, well, let's say the surgery date was the 9th. I choose which eye. Okay. Relinquish care date would be the 10th. That's just me making things up. Okay. And then I'd hit save. Or maybe the surgery date was the 10th. Relinquish of care, 10th. I'm going to hit save. Now I'm going to move over to Encompass EHR. And here we go. As you can see here, my Odin sitting here. There's something I want to show you that I could do the day before Odin came in. What I could do is I could document the patient care team. And when I document this care team, it will allow us to know that which doctor performed the surgery. It's a co-managed visit. It will label the care team right across the top of the visit. I'll show you what I mean. I'm going to click on Odin's name because it's the day before the visit and I don't want to create the visit just yet. I just want to prep his chart. I'm going to go within edit patient data. I'm going to go over to the left-hand side. Sorry again. And I'm going to go to practice data. I'm going to come down and we're going to find the referral part of this. So the patient referrals, right? And under here, I can list a primary care. I can list the doctor if I have multiple doctors in my office, which one referred them out. I can say patient is a co-managed. I can give the doctor that, the ophthalmologist that completed the information. And I would be able to list the patient care team. I can list the dates and I can do all this. And I'll show you what it looks like. Well, let's go do it here. I'm just going to add in something here. Give me a second. I'm going to add a contact here so you can actually see what this looks like. And I'm going to put last name test, first name test, and I'm going to put I want ophthalmology. Here we go. Of course, I would add the fax number. We'll just use this information, and I'll hit save. Okay. Now, as you can see, I was jumped out of Odin's chart because I had to go add that information. So I'm going to come back up here, find the last 10 charts I've been in, and click on Odin. I'll resume his visit. Well, actually, let's go back into the edit patient data before I create the visit. I'm going to do practice data. So I had to jump out of his chart real quick because I just want to show you actual documentation. And we're going to go here and put in test. Okay. And that was his doctor until today. He'll be our doctor, or yesterday, whatever I want to put there. And I'll come down and I'll hit save. And then what you see at the top is you see he's a co-managed patient and you'll be able to see the care team. So even if I added the PCP or the referring provider, it would be listed here too, giving you a quick glance of the information. Okay, that has nothing to do with documenting the actual visit and getting the correct coding for the visit. That's what we're going to do now. So next day comes. Odin is still sitting here. We need to create his visit because it's the following day. So we're going to create his visit. We're going to go through this chart just like you would any other visit. Nothing special in the beginning, okay? So we're going to do a chief complaint. And we're going to add a new chief complaint. And we're going to do post-op here. If I can spell it correctly, guys. Now, when I did post-op, like I said, there's several different post-ops you could have done. You could have done the glaucoma refractive, but today I'm doing a cataract, okay? So I want post-op cataract. Let me make it more specific. And there we go, right here. And as you can see to my left-hand side, it was listed there under my most frequently visits. We're going to do right eye. Okay. I'm going to go over to the left-hand side and we're going to provide details. Now, when it comes to providing details, of course, it would be whatever you're going to document what is presented to you that day. But it will be a follow-up post-op surgery. And I can say improved. Now, doesn't matter if what type of surgery you had. Of course, we want to document that. I would, right? So I could have said cataract extraction with IOL. And anything else that pertains to the patient. Any type of documentation, the world is yours here. You go for it. I'm going to come down and choose save. Of course, I'm going to jump to the left-hand side and do my review of systems. You feel free to document anything else that pertains to your visit. And I'm going to mark custom reviewed. And I can add and change anything in here that needs to be added or deleted due to the visit. Okay. I can come all the way down and hit save. I did not choose save and continue because I did not want to go to the next tab and document family history. But I do want to jump into the vision exam. All right. Maybe you want to document his new acuities, I would assume. I'm going to do the acuities. Distant type, we're doing the Snellen chart. If there's no correction type, we put none there. And we can document how we find his new vision to be. And that's how we'll do that. Okay. And notice I documented under corrected. We can jump to the pupils. We can put our results in as normal. We can go to our motility. Okay, we can mark this as normal. And if it wasn't normal, of course, you can mark however things are going, and please document your test type. Right? Visual fields, we can also mark at normal. Now, guys, take a look, because I just told you can mark pupils, motility, and visual fields as normal. But we could have done all that right here too. So don't forget the software is no different than what you already use. Okay. We're going to go to the left-hand side. Maybe we need to document our pressures too. So we're going to give them some pressures here. 10 in the right eye and 18 in the left eye, and we'll hit save. We can do our dilation drops if we're dilating today, and just do drops installed in clinic. We have our drops here that we usually use. If we're changing our drops, feel free to make those changes. Okay, I'm going to hit save. So far, we documented the chief complaint, the vision exam, and now we're going to move to the ocular exam room, and that's where all the magic happens. Okay, I think the magic's going to happen here. And when okay, I'm just going to tell you what I did, but we are going to perform an exam. We're going to perform an eye exam. I did dilate, so I won't be turning off my dilation. But if I needed to document anything else in here, my cup to desk, anything that you feel necessary for your exam, then you make sure to do so. I'm on the advanced mode here, so if it looks a little different, that's why. Advanced mode is simply up to your upper right too. You can turn this on and off to get different views. And I'm going to copy. I'm going to come down to my bottom right, and I'm going to hit done with exam. Okay. Diagnosis. In most cases, we know it, well, it should mimic the ophthalmologist diagnosis, right? So I'm going to just document in what was received to me. If that's the case, and when I document in, when you type in Z984, you get your different options here. You're going to choose which one is best, what best fit your situation. So your diagnosis code is not necessarily what I'm putting in, but what you need to put in. Then put in post-op cataract. It was the right eye. So I'm going to go ahead and click on the right eye here. Okay. Now, when it comes to findings, guys, there's a couple of few different findings. Might not be any. Okay. Might be a 1+4 AC. Could be a 1+4 corneal. Could be anything here, but that's not what I want to show you today. Today, I want to show you how to customize a finding, because sometimes when you do things, when you do specific diagnosis, you might need to actually customize that finding. Okay. So I'm going to customize this finding here. Within this finding right here, I'm going to go ahead and type in clear and center PCIOL. Okay. Positive, I want the finding related to SLE lens. And I always want it to be remembered. So anytime I use this diagnosis, then this finding will be remembered. Okay, it'll be an option for me to use. Okay. So far we have the diagnosis. I'm using a post-op cataract. You might use other things, and there's nothing wrong with that. All right. I actually custom a finding that I want it to be remembered so that I can use it next time I use this diagnosis. It's an option there, right? It's not necessarily stuck with the diagnosis. It's just an option. Now let's talk about our plans. So, very first plan I would like to use, I'm going to go ahead and use a post-op plan. And I'm going to use the post-op evaluation cataract plan. Now look, if you are not going to use the 99024, then you must turn it off here. So if you don't want this procedure code to be part of your documentation, let's turn it off. Location I'm going to use right. I can go under my details if it's day one, which it is going to be for me. But before I go there, I want my post-op day, and I'm going to put day one here. Okay. Like I said, there's tabs within up here. Personal protocols you can use, like maybe the patient, if the patient's using anything, patient received drops, any documentation for your first day will be under here, as well as your week. So that's my post-op evaluation cataract plan. And we are not using the 99024. So I'm going to go ahead and choose done. Right? Okay. Then I want my co-managed plan. And it's co-management, actually. And you must spell it right. And you must be typing in the right place. Okay. And maybe, oh, I know what I didn't do. So see how it didn't come up? I need to hit complete plan search and then it does come up here. All right. Now, this is going to specify the operated eye or eyes, however you're seeing your patient that day. Okay, so we're going to do right eye because that's what I said we were doing. And of course, we're going to do our relinquish versus assumption of care. So we're assuming care. We didn't relinquish care. We have our CPT code that we do want to use, and you would choose whichever one best fits what your patient's being seen for. Okay, and I'm going to choose done here. So far, that's our post-op evaluation cataract plan. That's our co-managed plan. And we got a few more we're going to use, okay? We're going to set the global period days. So I'm going to type in set. I'm going to choose the set global period days. Location. And there's a reason why I'm being so redundant. But yeah, my location's here, okay? And you must select location here. Then I want to come down and other surgery global. I'm going to put there date of surgery. And I think I said the date was the 10th. I went back between the 9th and the 10th, but I'm going to leave it at the 10th. Okay. And I'm going to choose done. I'm going to come up here to the top. I'm going to type in F as in Frank /U. Do my follow up next visit cataract, follow up time frame. Okay. So when do you want to see them? Bottom line. I'm going to put 8 days just because. And of course, down here, we have the option to document what will be going on the next time we see them. If it's for the next eye, then we're okay there too. And I'm going to choose done. I'm going to complete done with diagnosis and plans. And I'm going to come down to the very bottom to make sure everything I want is here. I have it in my left eye, not just in my right eye. We need to make some changes there. Post-op cataract, everything's good here. Okay. And I'm going to hit save for just now. Well, before I hit save, let's talk. You only need the post-op cataract diagnosis and the post-op evaluation cataract plan. Where you can enter the details of your evaluation. But when it comes to the co-manage and the set global period, you only need to be that only needs to be applied to the initial day one visit. Okay. So the post-op evaluation cataract and is what you really need to document your details, okay? But when it comes to the co-manage and the global period, then you don't really need those on every visit if you don't have to use it, okay? I'm gonna come up here for a second. All right. And we're gonna come down. Of course, you can make any changes. Oh, I could change my findings if I wanted to. And I'm gonna hit save visit note, bottom left. I'm gonna go ahead and view my visit note. and it will allow me to see what I documented. And if I'm okay with everything, I can finalize the visit to the right-hand side. I'm going to finalize that visit note. What I'm going to do is I'm going to move right back over to my practice management, so Encompass, right? I'm going to refresh the screen. I'm going to click on Overview for Odin here. And sooner or later, Odin should have a exam come over. And when he has that exam come over, you'll be able to see it's still finalizing. That's what I came back in here. So while we're waiting for that to go on over to PM, there's something I want to show you. If by chance I did not want to complete all those steps again, but I do co-manage often, I can come up to my upper right-hand side. I can go to Preferences. I can manage protocols. And I would be able to add this protocol. I can name it exactly what it was, right? Which was the post-op. Put that in there. Post-op cataract OD. If I had my medical and my refractive protocols separated, I'd be able to put it into a category. If I would like to share with another provider in my office, I could do so here, and I can choose Save. As you know, with any protocols, we do not add specific patient measurements, right? So I'm not sure I want to add the exam. Maybe you do, and that's okay. It's your protocol. I'm going to come down to my findings. I'm going to put in my code if I want to. Maybe you don't. And if you do, then you go ahead, okay? I'm going to do just a post-op here, right? Then, of course, I said it was the right eye, so I would do my right eye. And then I can put these plans in. So I would go down and use the same plans that I just used, which of course would be my post evaluation, which is right in front of my face. Didn't have to go looking for it. Okay. You can choose to do your location, your day, if it's day one. So you can pre-document this. You can move that code up here. If you don't use it, you choose done, right? You can come back up to the top. You're going to use co-management. Don't know why this word always stumps me, but it does. Okay. You're going to complete that code search. There's your co-management here. Have my right eye, I'm assuming care, of course, whatever co-management CPT code if you want, but this can always be changed. Choose done. You can set your global period. Here we go. That's not what I was looking for. Ignore that one, please. Here we go. And here we go. So we can put what we need to put in here, date of surgery. I probably wouldn't put because that's going to change and I don't want specific measurement. I just said it was the right eye only, right? And choose done there. You can choose follow-up. Next cataract. I wouldn't put a time frame in unless you know it's going to always be this time frame, day one, and then I always see the patient 7 days later, 5 days later, 8 days later, whatever it is, you would put that there, okay? And I'm going to choose done here. And I can save this visit, this protocol, I mean, and now I'm always going to have that post-op protocol that I can use as needed. And I can make one for OD. I can make one for OU and remove an eye if I want to. I can make one for OS. The world is yours when it comes to protocols. Go back. Let's see if the Odin's visit came over. Let's see what we actually sent. Are we lucky enough? And his exam is pending now. So if I was just to click on the pending exam here, you can see that this is the procedure code I chose to send along with the diagnosis code. My modifier and my eye came over. Thank you for joining me today. That concludes my documentation of the post-op cataract evaluation, except for one thing. If you listen to all of this and you say, I understand what Kimberly said, but I just have some questions, there's a help tab in the upper right-hand side. You can click on that help tab. You can do help topics. Okay. And what you can do is you can type in co-management. And EHR is here to get you help. Let's see. Cataract. Yes, there's none there. Oh, I got to spell it right. That I got to type in the right spot, guys. The heck. Now I'm here. CATARACT. Oh, wrong environment. Sorry about that, guys. How about if we were in EHR and we actually asked for help? Don't be a Kimberly. Make sure you're in the right environment. Okay. So when I type in co-management, I got the documenting cataract post-operative care, editing patient care team, data on the iPad. We got documenting on the iPad, okay? There's generating eye care reports that you can see under here. So if you need to, you make sure you're, first of all, in the right environment, and you go up to the upper right and you use help. Thanks for joining me today. As I said, I am Kimberly. It was a pleasure working with you, and that does conclude my training for my training webinar for the co-management in Eyefinity Encompass.
Kimberly?